Hello, everyone. Um, Today I want to talk to you for a few minutes about joint movement dysfunction. You all know what that is, right? You remember, the big thing that we try to accomplish here at Westport Chiropractic for our patients is to restore normal movement. A lot of people come to us in pain, but the reason they hurt is because they have problems with the way they move. Now, movement can go bad two different ways. Movement can be restricted, which ultimately leads to tissue stress and pain, or movement can be poorly controlled, which ultimately leads to tissue stress and pain. Movement restriction can come either from sticky joints or tight muscles. We call the sticky joint movement restriction problem JMD, which is short for joint movement dysfunction. So, JMD is a joint, say for example, one of these joints in the spine, that has lost its ability to move freely in every direction. Now, when we're talking about spinal JMD, that's a bad thing for four reasons. The first is that it commonly causes pain. The abnormal movement at the joint leads to stress on one or more of the tissues that surround the spine, the nerve, the disc, the ligament, the muscles, so on. Leads to stress in those tissues, which causes them to ultimately break down and hurt. So that's one reason that it's bad. The second reason that it's bad is that it often causes JMD somewhere else. Now, this is a little oversimplified, but suppose I had a joint in my low back that knocked me over, that had me stuck in this position. Well, I wouldn't walk around like this. What I wind up doing is going back like this. And boy, before you know it, I'd have another stuck joint right up here in the top of my neck that was caused by the stuck joint of the JMD down in my low back. So, second reason it's bad to have JMD is it causes JMD in other places. You may have had the experience of your doctor examining and adjusting your foot or your knee or your hip, even though you don't feel any pain or discomfort in those places. But having JMD in those places often causes JMD in a low back, a mid back, or even all the way up in the neck. So, one, causes pain. Two, causes JMD in other places. Three, makes our joints wear out faster than they should. Now, what do you call a worn out joint? Arthritis. So, and think about it. If the front end of your car is properly aligned, even though your tires revolve millions, tens of millions of times in the course of a year, the front end is properly aligned, those tires are going to wear, but they're not going to wear out very much. Misalign that front end just a little bit, and even though no single rotation is that big a problem, the tires rotate so many times that the little bit of stress from being out of alignment, repeated millions of times, makes your tires wear out faster than what they should. Exactly the same principle applies to JMD in the spine and actually anywhere else in the body as well, the foot and knee, hip, whatever. When the joint doesn't move freely and it has to move in a difficult, stressful way, movement becomes more stressful to the tissues around the joint, and it just wears out / develops arthritis faster. So, one bad reason causes pain. Two bad reasons causes JMD somewhere else. Three bad reasons causes joints to wear out faster than they should. And the fourth reason is that the spine is the distributor of your body's nervous system. All up and down the spine are nerves that come out and branch, and the branches branch, and the branches of the branches branch, until they go everywhere in your body and wire every part of your body up to your brain. And that's how your brain is able to control everything that goes on in your body. Now, when spinal joints get stuck and don't move properly, they affect the nerves that come out of the spine. Now, they affect them in an unpredictable way. But in the long time that I've been doing this, I have seen patients, and by the way, none of these patients came in for the problems I'm about to state. They came in because their back hurt. I have seen irritable bowel syndrome disappear. I have seen asthma disappear. I have seen menstrual cramps disappear. I have seen women who've been trying to get pregnant for years get pregnant. And I could go on and on and on. Now, we clearly don't advertise, we cure asthma, we cure irritable bowel syndrome, we cure infertility, because we don't. However, there are times when the irritation to the nerves caused by joint movement dysfunction is actually significant enough to produce the problems that I just explained and many, many, many others. And every time you have JMD in your spine, it's as if you're taking a dimmer switch attached to the power supply to wherever that nerve goes and just turning it down. So that no matter what's going on in that part of your body, it's just a little weaker, a little less able to adapt to the stresses of life, not as strong and stable as it should be. So there are 4 reasons why it's bad to have joint movement dysfunction in your spine. First, it causes pain. Second, it causes JMD in other places. Third, it makes your joints wear out faster than they should. And fourth, it interferes with the normal functioning of your nervous system, just lowering your vitality and your ability to withstand and adapt to the stresses of life. So, I hope they found that interesting and useful, and I hope you also consider that other than pain, a person wouldn't be aware that the other 3 things are going on, would they? They wouldn't be aware that the joint movement dysfunction in one place is causing it somewhere else. They wouldn't be aware until very late in the game that their joints are wearing out faster than they should. And they wouldn't be aware, they would be unlikely to be aware that they're running on 80% power because of the irritation, the disruption of the nerve function from the joint movement dysfunction. So that is one of the compelling arguments for correcting joint movement dysfunction in your spine, even if you're not hurting, because it decreases your risk of bad health outcomes in the future and improves your risk of good health outcomes. Sorry, that was kind of long-winded. I appreciate your attention. If I don't see you before then, Merry Christmas.